All right, so you're dispatched to a residential neighborhood for a 25-year-old male with uncontrolled bleeding.
All right, with my PPE's on, is the scene safe?
Scene is safe.
All right, mechanism of injury since the patient is bleeding. Requesting additional ALS support and need for C-spinal considered since it's a trauma. As I'm approaching my patient, what is my general impression?
Your general impression is your patient sitting on the curb, holding his forearm with whatever clothing he has, and it looks like he's in pain.
All right, as I'm approaching the scene, I see the male sitting down with a soaked rag covering his bleeding. Hi, my name is Gabriel. I'm with Salinas EMT. Do you know what your name is?
My name's Damien.
Your name is Damien. Do you know where you're at?
I'm at my residential area.
Right. Do you know what year it is?
The big 25.
Do you know what happened?
I was working on my car and some metal piece fell on my arm and made me bleed like crazy.
Okay, no worries. I'll go ahead and check that out for you. All right, as I see right here on his right forearm, there's a deep laceration here. So I will be applying a tourniquet 2 to 3 inches above. As I apply the tourniquet, it is 1:47 p.m. I'll be checking his pulse, his skin temperature, and quality of the pulse on his left arm.
Also, his skin is cool, pale. His pulse is 120, and his pulse is rapid.
Okay, as I'm right here, I'll be checking his airway. He's able to talk to me, so there's no blockage. His breathing, I'll be listening to his breathing. What is the...
It's non-labored and 18 breaths per minute.
18 breaths per minute, okay. So since he is bleeding, this will be a code 3, and be taking him to a hospital. All right, so I'll be checking a complete set of his vital signs. All right, so I'll be checking for his blood pressure. I'll be checking for his respiratory rate. I'll be checking his SpO2 levels.
So blood pressure comes back to as 112/70. Heart rate comes about to 118. Respiratory rate is 18, and SpO2 is 98.
All right, so sample. All right, so are you allergic to anything? Any allergies that you have?
No.
No, any medications you're under?
I'm not under any medications.
All right, do you know what you last ate?
I think it was a baby 2 hours ago.
There you go. Do you know when your bleeding started?
Started like 30 minutes ago.
30 minutes ago? Okay, so I'll be doing my secondary assessment. I'll be checking the head, making sure there is no laceration, any deformities, checking his jugular, checking if anything moved, any deformities, checking the back of his neck, seeing if anything happened. There's nothing, it's all clear. I'll be checking his abdominal to see if there's anything that's off with it, anything that's wrong with it. And then after that, I'll be checking be palpating his pelvis. And in this example, I'll be using this backpack. As I'm checking it, it feels right. Nothing, no deformities.
No deformity there.
Okay. Then I'll be asking the patients, do you feel your arms? Do you feel your left arm? Obviously, I'd assume you don't since you have the tourniquet on. Do you feel your right? Everything's good?
Yeah, I can feel it.
Are you able to move your feet?
Yeah.
Are you able to pull forward?
Yeah.
Push against it? Yeah.
It doesn't show, but I'm pushing. My foot is pushing on his hand.
All right. And I'm checking if there's any deformities on his lower extremities, anything on the leg.
Pushing my leg.
All right, this is his leg. Making sure there's any deformities. There's nothing. Push on it. Pull on it. All right. The other leg. Checking any deformities. There's nothing. Pull on it. Push on it. All right. And I will be checking his buttocks area. This backpack will be an example. Lifting. There's feeling for anything. No extremities. Nothing wrong with it. And then I'll be checking my vital signs once again, seeing if there's anything that's wrong with it. I'll be reassessing the patient every 5 minutes, and yeah.
That's it.